Hey everyone, welcome to my channel. My name is Tiffany Hensley, Peerpoint, and today we're going to be talking about triple negative breast cancer. So, what is triple negative breast cancer? Triple negative breast cancer is a cancer that is not fueled by hormones, and it can't be treated with hormone or chemotherapy pills. Hold on just a second. I'm trying to make sure my husband gets here. Hold on, I gotta send my husband an email to get him in here, so he's gotta be part of this. Okay, so triple negative breast cancer, like I said, it's not fueled by hormones, and it is very fast growing, very aggressive disease. So let's rewind back to 2022. In 2022, I was diagnosed with triple negative breast cancer. I had a 2 centimeter size tumor. The recommendations was chemotherapy with surgery and radiation afterwards. So I went through the chemotherapy as best that I could. I was severely allergic to the treatments. Severely. Like, they couldn't counteract it with Benadryl and the steroids like they do most people. So I struggled with that until it had to stop and I couldn't finish the treatments, and we went on to surgery. Well, at the time of surgery, everything looked good. I had a complete pathological response, meaning that all my margins were clear. There was no cancer cells at those edges, and there was none in the lymph nodes, or LVI was clear, which is the lymph vascular invasion part of pathology, and mine was clear. I was good to go. They said 2% chance it'll come back in your life. Well, let's fast forward to July of 2025. And I was diagnosed with breast cancer once again. I felt like a pea size in my breast. It was the same breast, almost identical to the spot that the triple negative was at in 2022. I had the biopsy done, and it came back as DCIS cancer. Now, DCIS cancer is non-invasive, and it doesn't break out of the milk ducts. And it's, people can live with that for many years with no surgeries, nothing. So I went to a new surgeon this time, and he recommended a mastectomy on both breasts, complete removal, no lumpectomies, no conservation, and that was very hard for me. I didn't want to do this because I couldn't have the reconstruction right then because I smoke. And apparently, women who smoke are not eligible to have reconstruction until they quit. And that was at this time, you gotta think, I'm going through so much. I'm not excusing it by no means, but that was my stress reliever. That was I enjoy smoking. So I couldn't give it up that easy. I tried and I just couldn't. So I kept resisting and pushing back. And the more I resisted, the faster this thing was growing because it seems like after the biopsy, this cancer took off at an ungodly rate of speed. Like it went from like a size of a pea to a size of a golf ball in 4 months. And that's being literal, maybe a little larger than a golf ball. It was very large. And so I had the surgery, had my left breast removed, and the first pathology came back as DCIS cancer all over the breast, like a large 5.1 centimeter area of DCIS cancer with multifocal disease behind it. And with a lymph node, one lymph node S6 was found to have isolated tumor cells in it with, you know, on a normal day, we're looking at, maybe radiation, maybe not. My surgeon decided to send this off for further testing because it was a second cancer. DCIS was a second cancer. So he sends it off, and the final pathology took a couple weeks to come back. And when it did, it showed LVI, which is lymphovascular invasion. And that's your blood vessels, not your lymph nodes. So your blood vessels are like your highway to everything. At first they thought, well, maybe the knife during surgery just was artificial and pushed some cells into the vessels, and it was just artificial, not like a confirmed diagnosis of, yes, you have it in your vessels. So upon further testing and more pathologists reviewed my case, it was confirmed that I had extensive lymphovascular invasion in my vessels. And the receptor status came back from that multifocal disease that was branched off from the DCIS cancer. And it was confirmed to be triple negative breast cancer. And the DCIS was the new cancer. I make this video because I haven't found a lot of information about my particular profile. Actually, I've found none. my AI has helped me generate what would be standard, theoretically speaking. I'm not a doctor. This is just for information purposes only. This is my story, not yours. I just feel like I should share it, hoping maybe it'll reach an oncologist or somebody, maybe at MD Anderson, just anybody who could give me some answers, because I'm not getting that. My KI, or key 67 marker, showed 87%. And what that means is it's the speedometer of cancer growth and proliferation. So, for example, at the time of the removal of my breast, out of every 10 cancer cells, 9 of them was multiplying and dividing very quickly. So anything below 20 on a key 67 is considered low and kind of harder to target with chemotherapy drugs. Anything above 20% is considered high, and mine is at 87%. Okay, so when you take the negative receptor status and you take the key 67 status, and then you take the lymph node status of isolated tumor cells, and the final pathology revealed, there was a less than a millimeter deposit of metastatic disease there, but it's there. As far as the vascular system, it came back and confirmed that the cancer cells had made its way into the vessels as extensive, abundant, and at a fast growing rate at grade 3 cancer. I'm not an oncologist. I can't really explain to you the difference between stage and grade, but there is a difference. The grade is stage is where how big the tumor is and what has been invaded. In my case, my stage was lower this time than last time, but the grade and the urgency is a lot higher. The stakes are a lot higher. Now my life is on the line. So, we don't usually ask our doctors, what's our prognosis? But I did. And I thought, what if I just walk away from this and live my life? Well, then what? Well, my doctor told me that they don't follow women at this point if they decide to walk away because there's no sense in it. They know the result. And that's ultimately they die. Of course, I don't want that. But I also think of quality of life. And with the chemo, I'm allergic to. And so I've had to put all this information into an AI. And it did pull statistics and data from what it knows and what is available. And upon that discovery, my AI says that standard recommendation for my profile would be continued chemotherapy for 4 to 6 months like I had previously, the same regimen, but I have to complete it. And this time they're recommended 25 treatments of radiation, and that has to be done daily. Radiation I'm okay with. I'm not really okay with the chemotherapy, but I'm willing to do anything to live. I have a family. I have kids, like most of us do. Of course, I want to live. Some days I can find myself just looking at the world around me and thinking, man, it wouldn't even matter if I wasn't here. Nobody would even notice, In reality, life goes on. But I want to be here to see it, So I guess I'm just trying to find some answers. If anybody has been in my situation or has experienced anything that I'm going through, a DCIS non-invasive cancer that comes back to be a reoccurring triple negative, with DCIS covering a majority of the breast, this is less than 2 years, we're right at 2-year mark, and that's when triple negative usually it shows itself. The good news is I had a complete pathological response to the chemotherapy that they used. I just didn't tolerate it well, but I guess I'm going to have to go about it again and do what I can. So we know that the chemo does kill this type of cancer. And the high proliferation rate of 87% is the main go-to would be chemo because it tends to work better on a higher proliferation rate than a slower one. So I'm thinking that, the cells that are in my body and my vessels have to be cleaned up, and the only thing that can do that is chemo. As far as genetics go, I do not have the BRCA gene. I have no genes that point to this, and I don't think that's very uncommon. So yeah, I'm kind of limited on what I can do here in this situation. It's been about 7 weeks now since my mastectomy, and I have noticed symptoms. I've been nauseated every day here lately for the past week or so, and I have ear infections in both ears, like severe ear infections right now. I haven't had an ear infection since I was a child. I'm not sure if that's related to any of this, but it's odd. No fever, nothing like that. Back pain, bone pain. I could say that's from past chemo treatments and things like that, but I don't know. I mean, I don't know. Triple negative is a very dangerous cancer, and I want you to know that. It is very sneaky and it is smart and it evolves and it grows and it learns and it hides dormant until it's ready to make its move. And that's what happened in my case. Even though there was clear margins, that wasn't the case. It was just not able to be seen at that time. If anybody is watching this that could give me some advice, I would appreciate and gladly accept that advice on new treatments or options available to me. I am still waiting to see chemotherapy and seeing what their plans might be. I know from AI's perspective, the standard regimen for me would be 4 to 6 months of a completed chemotherapy plan with radiation completion in order to lower the chances of this cancer coming back within a 5-year rate. I think if I do nothing, the way I understand it is my prognosis is not good. A third time of triple negative breast cancer is almost always considered deadly. You do have options, but then you start considering your quality of life. When you get to stage 4, it's considered non-curable. I'm not there yet, thank God, and I am blessed for that. But triple negative has a tendency to go from a stage 1 to 4 in no time. We're not looking at years for a tumor to emerge. We're looking at weeks. And now would be the time I would show symptoms, which I do have. I don't know that they're related to the cancer, but we shall see. And continue uploading videos as I continue this journey of life and survival. Thank you for tuning in, and please subscribe to my channel.